Uh, Today, I'm pleased to be able to discuss with you long-term care reform. I'm Diane Rowland, the Executive Vice President Emerita of the Kaiser Family Foundation and a longtime scholar of healthcare policy and reform efforts. Long-term care, or long-term services and supports, as we now refer to it, is one of the oldest unsolved social policy issues in the US. We've made limited progress over the last 50 years, but as the aging of our society looms, there's much more that needs to be done. What is long-term care? It's the services and supports in institutional or community settings that individuals need when their ability to care for self is compromised by chronic illness, disability, and aging. It ranges from nursing home care in institutional settings to increasing care delivered in the home setting and in the community by those who wish to remain in their normal setting for their services and care. Well, who needs this kind of assistance? It's persons with intellectual and developmental disabilities, persons with Alzheimer's and other cognitive deficiencies, and persons with physical disabilities. It is estimated that there are some 11 million people, one half of whom are over the age of 65, who need some assistance with the activities of their daily life and with their ability to live independently. 1.5 million of these individuals are currently in nursing homes, a number that has interestingly not changed very much over the last 2 or 3 decades. 81% of those in nursing homes are over the age of 65. The remainder in the community are really divided half and half between those over and under 65, including children with special health needs and many people who qualify for the disability benefits under the Medicare program. Long-term care itself is extremely expensive. A private nursing home room has a median cost of $108,000 in 2021. Home health and personal care aides, depending on how many hours a week, can range from $60,000 to $70,000 a year to just enable someone to stay at home. And we know that the heaviest burden still falls on family and friends who, without compensation, try to fill the gaps and meet the needs of those who have healthcare challenges and want to remain at home. Now, how is it financed? Well, that's the big puzzle and one that needs the most solutions. Long-term care spending in 2020 was some $443 billion. Medicaid, the program for low-income individuals and seniors, picked up about 45% of the cost of that care, and private insurance, another 10%. 15% came from out-of-pocket expenditures by families, and 26% from other public and private funds. But that doesn't tell the whole story, because much of that care was actually delivered by family caregivers and friends who received no compensation other than taking care of a loved one for their efforts. So why do we need reform? We need reform to ease the burden on families, to ensure a more stable and caring environment for those with those healthcare challenges. Medicaid is primarily a financing source, but the eligibility is extremely limited to those with very, very low incomes or severe disabilities. It varies by states, and even the availability of home and community-based services under Medicaid varies depending on whether the states have implemented a waiver or not, and often incur huge waiting list times to be able to get those services. Private insurance is primarily helpful in protecting one from losing all assets when in a nursing home, but is extremely expensive and the premiums go up with age. Medicare is very acute care focused. Most of the long-term services provided through Medicare are as a result of an acute stay in a hospital for post-acute care. It is not a source of ongoing long-term care and assistance. So family caregivers raise the huge burden of taking care of those that they love and help, except it is a cost not only to the families, but to our society, because it means they can't actively participate in the workforce. They can't actively take care of the other family challenges they may face with children and with other members of their family that need assistance. So that we really need to figure out some way to fill all these gaps, to put these holes together, and to provide the kind of comprehensive care that we now provide for medical care through the Affordable Care Act and through Medicare, and for the low income through Medicaid, to provide some form of integrated long-term services and supports to help our families shoulder the burden of caring for loved ones as they age and face disabilities. Thank you.